powerful than that seems to be insane.
I agree with you. It's irresponsible. The entire opiate crisis was generated in part by the fact that the feds let Purdue Pharma just go crazy prescribing hundreds of thousands of OxyContin prescriptions. Yes. And that company, man, that company got fined $635 million, which sounds like a lot until you realize they made like $16 billion.
Yeah.
Those
drop in the bucket.
Yeah. So those people are now some of the richest people in the country on the backs of American communities, and it just keeps morphing because it went from oxy to heroin to fentanyl, and then you have people who are struggling with this addiction. So to me, it was federal negligence that unleashed this plague. I mean, you got to hold the Sacklers and Purdue Pharma accountable because literally now they're profiting from one of the treatment drugs. It's really obscene what they're doing. They're just like, hey, my non-addictive wonder drug turns out to cause a super plague of lethal addiction for hundreds of thousands of Americans, but now I'm going to sell you a new drug and try and make money on the back end too. So you got to get as much money as we possibly can from that family in particular, but then you have to make resources available and try and get people to depend on these drugs less, like on the front end from the doctor end. It's just like, look, why are you prescribing like these opiates when, like, there was a doctor I quote in my book where he's like, you've never seen a lethality rate for something prescribed for like a non-life-threatening condition.
Yeah, it's
like literally like a non-trivial percentage of people you prescribe an opiate to will be dead in 5 years.
Yeah.
And the thing that came to you, for in the hospital wasn't life-threatening.
Right.
It makes no sense.
It's crazy.
So we have to make treatment resources available, but this is a very human problem. It's not a money problem. Like, you can throw money at some problems and it works. This thing we should throw money at to try and give people a fighting chance, but then you have to support the people coming out because it's a brutal, brutal process trying to become whole and healthy if you're an addict.
It is an unbelievably brutal process, and it's. I have family members that are affected by it, and people with hurt backs that got on these pills, and next thing you know, they can't get off of them, and it's devastating, and it's so common. It's just all throughout
everywhere.
the country.
It's everywhere.
They'll prescribe you for nothing. I had my nose fixed. I had a deviated septum, and the doctor prescribed me 2 different kinds of opiates, and I said, I'm not in any pain. And he said, yeah, but you could be, so here. And I'm like, but I don't think this is a good idea. I'm like, I don't even want anything. And he goes, well, just take these just in case. And when I tell you, I'm not playing tough guy. It just didn't hurt.
Yeah.
It was a little annoying. I was like, oh, my nose feels weird. But I didn't need fucking opiates.
Seriously, man.
They're just willing. Like, here you go. Come on, what are you paying? Here you go. Come on, take a little of this, take a little of that.
Yeah, and I have a guarantee for you that their incentives drive them more towards dispensing those drugs than they're not dispensing those drugs.
Yes.
And it's in large part because the incentive structure of our healthcare system is so revenue-oriented.
Yes.
It's like, if I do more stuff, if I give you more stuff, I make more money.
Yeah.
If I decide you don't need it, I make less money. And that is one of the things that's driving us all into this unhealth, is that if you went to a doctor who legitimately was like, I don't think you need this stuff, like that would be the way many of them would see the problem if their paycheck was unrelated to the amount of activity that they were doing.
Yeah. When you look at all the issues that plague this country, and